Life sometimes come at you fast. Tragedies make your life unravel. You feel like you wanna give up and stay knocked down. Even when your heart is shattered, you still got a life to live. You still got a life to live, so don't give up. We are beautiful miracles. We are beautiful miracles. We are beautiful miracles, so don't give up.
Hello, everyone, and thank you for joining me today on my podcast, Beautiful Tragedy. If you like what you're hearing, would you please like, comment, share, and subscribe? And in today's episode, I am excited to have my new friend, Janys Murphy Rising. Thank you for coming today, Janys.
Thank you. Thanks for having me.
You know, it's kind of cool how we got connected. We're both podcasters, and we were connected on a community page. And I think that your story is a good story to be told. And it kind of talks about various different subjects that I want to talk about in my podcast. And, you know, this new season is opening it up to different types of losses besides just child loss. So, yeah, if you just want to tell me about yourself, tell me how it is you came to be in the world of grief.
Well, my big grief introduction came when I was in my mid-20s. I was in graduate school. My first semester in graduate school, we found out that my dad had a brain tumor. And what we thought was going to be a very simple in and out 6-hour surgery became 14 months of him being disabled, multiple surgeries, and the last 6 months of his life, he was on hospice. And so while I was in graduate school and I was learning how to help other people, I was also in the midst of helping him in and out of hospitals, negotiate nursing homes, negotiate hospice, negotiate new caregivers. So it was a complicated way to get introduced to grief. And that's actually a category of grief. It's called complicated grief, where there's just the difference is simply that, like, a simple grief that I can think of is that, you know, someone's grandma at the end of her life dies. And a simple grief doesn't mean that people don't grieve grandma. It doesn't mean that it's not painful. It just means that there were no mitigating factors. And with my dad, there were lots of different factors. He became disabled 3 months after his initial surgery. And there were a lot of factors that complicated it. And looking back, I think the thing that complicated it the most that I didn't have language for at the time was that he was negotiating going from being an able-bodied person to being disabled. And I wasn't aware that a lot of what I felt a lot like getting him help was like pushing a boulder uphill. And it didn't help that I was 25. And a lot of times people don't expect a 25-year-old to be taking care of someone that is, living with a brain tumor, living with brain cancer. So that was my introduction, and it's very much intertwined with my initial education experience as a therapist.
Yeah, you were definitely young, and you don't expect to be taking care of your parent when they really just kind of got done taking care of you. So I'm sure that's definitely tough in your mind to kind of, wrap your mind around all that.
It definitely grew me up very quick. I definitely had a lot of, I was pretty rebellious. My dad and I had a lot of love between us. My dad was a very loving dad. He was also a dad that was very much afraid to be a father because his own father was not healthy or kind to him. I actually had the opportunity to interview him before he ever got sick. I asked him to, I was a part of a cultural and diversity course. And part of that is that you had to interview someone in your family about, so I interviewed him about being Irish and our Irish culture. And so one of the things he shared in that stood out, there were a lot of things, but one that stood out is he said, if I could change anything in my life, I would have had different parents. And it's made me sad so many times because, I wouldn't trade him for anything, but I do in hindsight. And I think he's probably somewhere thinking this too. I wish he would have been more available, but because I think he thought he moved to Texas when I was 4 and he called us every Friday to see how we were doing. He came up twice a year to see us. We got cards in the mail. He was very active, even though he was far away, but
Right.
I wish I could ask him. I always thought he was afraid he was going to be like his own dad and that he just never wanted to hurt his own kids the way that he was hurt.
Sure. And, I
Yeah.
think it's important to talk about complicated relationships, because it's not always rainbows and butterflies, so being able to be okay with that because, previous generations, they there was things that they didn't know. There was things that were not available. And so now, our generation is kind of trying to break out of some of that. And, it's like it's hard to be upset with people when they didn't know
Mm-hmm.
any better. But, it's interesting. I don't normally say this early on in the podcast, but the quote that I end each episode with for this season was, you do the best you can until you know better. And then when you know better, you do better. And I feel like that's kind of what we're trying to do. And I feel like sometimes people need permission to talk about those complicated relationships and then also kind of what that can bring out in grief.
Mm-hmm.
So I don't know. I have a complicated relationship with my own father, and I worry sometimes about what his death might bring up for me because I don't know. I haven't experienced that yet. So
Yeah.
how did it be, how did it come to be that you wanted to, work in the field of grief?
Well, my main specialty is working with children and substance use. And then I work at the moment, I primarily work with adults, and I work from a lens of helping people figure out what in early childhood is now currently impacting the patterns that they're living with now. And I think that there's a grief to that. For me, since I became a therapist while I was actively helping my dad and then grieving my dad, I think that really had a sort of a permanent link to me always dealing with grief, even though, I say I work with grief, but I wouldn't say I specialize in it. But I became a therapist for a lot of reasons, but I think the main reason is that my mind has always been questioning what normal is. I have a lot of disability in my life. I am able-bodied, but I have 2 older brothers that have what are now called intellectual developmental disabilities. The names keep changing. Thankfully, they've taken the words that are pejorative out. And then my dad, when he was sick, became disabled at the end of his life. So I've always had this, why was I born the way I was born? And why, and I have red hair, and that always is like, why do I have red hair?
Right.
Which I know it doesn't seem like something, but it's always set me apart.
Sure.
And I was born at a time when red hair was not popular in the least. And then it became popular. So I became, and now I think it's just okay. It's like people don't care, either way about it.
Right.
But that sense of what is normal and what is abnormal. And what I've learned after being a therapist for almost 20 years is that I think the cultural definition of normal is very narrow. And the actual definition, when you look at normalcy versus pathology, is that there's just a lot of normal. The problem is that we have studied normalcy through the lens of, white researchers and male researchers. And I think we are absolutely trying to do better, but we need to reflect that more in research of what, development looks like. So yeah, that's always been my motivation, is coming from a place of, I like to question for people when they think that they're abnormal. I want to question, maybe that's actually more normal than you realize. And that's been my own personal path. And I think that's something that I end up holding space for when I work with people in my practice.
Yeah. Oh my gosh. One of the things our therapist says is talking about death and grief, and even specifically child loss, is normalizing the abnormal. Like for me, this was not something I ever planned on doing at all. So talking about a difficult subject is giving light to it and letting people know that it's something that happens, I mean, I don't like it, but the truth is, like I've been told before, I'm very matter of fact about death. And in some ways that kind of hurts my feelings. But in other ways, I'm like, well, I mean, none of us are going to make it out of this alive, So
Right.
It's like, I guess I don't, in a way, it's like, I don't understand it. Obviously, losing my son was totally a terrible, terrible tragedy. But at the same time, it's like, well, I mean, I'm not going to not talk about him just because he's not here, and why is that weird? I don't know. I mean, like, it's because I know people are like, oh, I just can't imagine. And it's like, I don't know. I mean, I'm not scared to talk about it because it needs to be talked about, and I think that talking with children, that's one of my focuses is acknowledging like children's grief and sibling grief. And, so letting people know about the different therapies and services that are available for kids because, I don't even know, maybe 20, 30 years ago, this kind of stuff wasn't as readily available for kids like it is now. And so I'd love to hear your, kind of your experience with working with children. And, I've been kind of unlocking a lot of childhood stuff for myself lately. So like hearing about just kind of that kind of work, I'd love to hear a little bit more about it.
Yeah. First of all, thank you for the work that you're doing.
Oh, thank you.
I reached a point with my dad's death where I just realized it's going to make people uncomfortable if I talk about it. And I'm actually not uncomfortable with it. So, what if we actually had classes where we talked about grief and death and like how to support people? I mean, the cultural, even in the DSM-5, I know they've changed the most recent term, but the last term, they finally put grief in the DSM, which I think is questionable. I don't think it's abnormal at all to grieve.
Mm-hmm.
And then they said a normal timeline is 6 months. And I was like, are you kidding me? I remember being excluded as a kid for my own protection from my favorite uncle's funeral. And I remember being very sad and very upset about that. And I think that early experience, as well as my experience with my dad, and one of my very first clients was a 5-year-old boy that had lost his dad suddenly. And I just saw so quickly that it doesn't really take that much to include them, first of all. And they need to be included. And so I think sometimes the fear is around like, I think parents well-meaning or people well-meaning don't want to talk about things that make kids sad or give them nightmares. But the reality is that kids are just sponges. They know what's happening and we have to give them language so that they can express it. Mm-hmm. The way that we grieve as adults, because, we've got all this history behind us and our brains are fully developed, is we have to talk about it before we get to the emotions. For kids, they don't really need a lot of language. They need play therapy. They need someone just to, say it, in a developmentally appropriate way, and use the words that are appropriate, like death is okay to say, or somebody is dead is okay to say, so that it's not confusing. Sometimes you say pass on and like a kid thinks, oh, so will they come back?
Or we lost our son.
Right.
Well, where'd he go? Let's find him. That's why we could not use those words.
Right. Yeah. And so, for me, grief is that it's something that needs to be expressed in our bodies. And, sharing language gives parents and other care providers opportunities for kids to just have that experience of grief. I think it's very normal for a kid to hear, okay, Aunt Sally died, and they're not uncaring. This is the way they process. They're like, okay, mom and dad, can I go out and play? And then, lo and behold, at some point they have a meltdown. And if you aren't aware that that's their grief process, they might get punished. They might get and so I think, giving places to express for tools for parents of like what's developmentally appropriate. And sometimes that's just checking in with somebody. I think the thing that's most developmentally appropriate for kids is if they ask the question, you can answer them. Yeah.
And you really don't have to give them all the information. Like I sometimes catch myself over explaining and then, I'm like, well, I just kind of try to give him the amount of information that he's asking and then leave it and let him kind of process. And, it's made it so that he's very comfortable. Like I told my friends, like after Jackson died, I said, I'm just going to let you guys know Ivan is going to talk about it, you know? And so if that's going to be a problem for you, I'm just letting you know, because it's very comfortable for him. And, you know, as much as I wish this wasn't the case, I mean, this is our story, and he's known other children who've died. And when we go to the playground, if he hears a kid say brother or 7, he says, my brother died when he was 7. And kids are like, huh? You know, and I used to worry. I'm like, well, I don't know if the parents in class are ready to have these conversations with their kids, but I'm like, well, I wasn't ready either. And, you know, I don't want to shush him and make him feel like he can't talk about it, because it absolutely affected him. And one of the things that our therapist said to us early on, Ivan's therapist, was it's better out than in, you know, and there would be times where he would say things or ask me questions that would just stab me in the heart. But I gathered myself and just answered those questions, because I saw with Ivan, when he has things that he can't process, they start really kind of pinging around in his head. And then it becomes a much bigger thing. And so like when he's having a struggle, I'm like, okay, I'm not exactly sure how to do this, so I'm going to take him to his therapist and help him kind of process that, because I've seen, it's so beautiful how children express themselves through play, and they say so much that you just don't even realize, you know, they run these scenarios, and it's really been quite an amazing thing to watch. And so I am definitely thankful to you for those services that you provide to families, because I know, I mean, without the help of our therapist, I couldn't do this. I didn't know how to do it. I did not feel equipped. And even though I still don't really feel equipped, I know that there's help available. You know what I mean? And so I don't have to do it by myself. And, you know, just that relationship, because she helped Ivan, but she also helped me. And, you know, I actually didn't really need this to be like the whole like conversation, but I'm very thankful to therapists who can equip a parent as well as the child, you know?
Well, it's interesting to me, Carrie, because we're not required to know anything about grief. And yet we know that everybody grieves or loses. You know, one of the exercises we did in one of my classes, which is pretty heavy lifting, is as adults, we do grief and loss timelines as a way to heal. And so you'd put on a piece of paper the age you were, the loss, and what happened. And oftentimes that's a grief within a grief, because, you know, especially, you know, I grew up with being told, you know, we don't include children, you know, because we want to protect children. And I understand that's all well-meaning, but I think kids, you know, have a capacity to understand. So I love this idea of like, what if we just had like, you know, not even grief and loss groups, but just death groups.
Yeah.
You know, a lot of kids lose pets and they don't know what to do. You know, as you're talking, I'm remembering, you know, a boy I went to school with that I didn't know very well. I knew that he had died in a car accident. And I remembered like, you know, wanting to have a place to talk about that, even though I didn't know him. I wanted to understand, you know, are the parents okay? Is his brother okay? You know, and so, you know, having those spaces where, you know, and I think kids are naturally empathetic. You know, I think it's more the culturally unwritten rules, which are bound or were first discovered in addiction literature, but I think they cross into trauma, grief, like everything. But the rules of families of children of alcoholics is don't talk, don't trust, and don't feel. And I think you especially see that the more complicated the grief, the more like, oh, that's not something I want to hear about. I mean, I heard so many times, you know, I would tell somebody, you know, years into having lost my dad, and people would say, oh gosh, that's the scariest thing for me. That's so hard. And I would be like, yeah, thank you for sharing that this tragedy that I experience is the scariest thing to you. I don't know what to do with that, actually. It is. And I remembered feeling that because I had supported friends of mine that had lost their dad before I lost mine. But I never thought to say to the person, well, what you're going through scares me more than anything in my life, because how does that help anyone? I think about that circle that they draw for people that are living with cancer or living with chronic illness. While they're going through it, you don't go to them to talk about it. You find somebody, in the next circle or the next circle. I don't know if you've ever seen this before, but the things that people feel like they can say, I think are a sign that, and I'm not judging them in any way. I don't think there's enough spaces to talk about death, because that's really what we're talking about when we talk about grief, when we talk about loss, is we're talking about the D word.
Yeah.
Yeah.
I was watching this wonderful documentary called The Wisdom of Trauma by Gabor Mate. And one of the things he said that has just stuck with me so much, he said, if we stopped looking at people and said, what's wrong with you? And say, what happened to you? It just first of all, it gives the humanity back to a person, and realizing, that people have a lot of wounds, and rather than just, faulting them for the way that they are, helping them figure out what happened, and, with Ivan, okay, I have alcoholics in my family. And so that's something that I do worry about, even though I know I have no control over it. It's okay, well, I can't control whether or not Ivan becomes an addict later in life. But what I can do is try to give him as many tools as possible now, so that when he gets older, maybe he won't have to turn to those things. I mean, it's a crapshoot. I mean, it may or may not happen. He's still young, and he may have troubles when he's a teenager, but we've already kind of established that therapy is okay, that they're helpers, they're like we say, they're doctors for your mind, kind of, and for your emotions. And so to kind of already have set that groundwork for me, that's something that I feel like is trying to break that generational curse of, we don't talk about it. We don't do any of that kind of stuff.
Feel.
Right.
Well, we already know what happens when we don't talk, trust, or feel. And so, just because it's an unknown doesn't mean that it's worse.
Yeah. Yes.
Yeah. And we already have research that shows that when you have early childhood experiences that have adversity, and the big factor that they don't talk about with ACEs studies, adverse childhood experiences, which are flawed for many reasons, but they're working on making them more diverse in their research. But what we know is that if you don't have a trusted, more knowledgeable adult to talk to, that's really the remedy for kids, and it's simple. It's as simple as somebody coming up to a person and saying, my brother died and he was 7, and someone just being able to go, that was really hard. I bet you miss him. What was the best thing about your brother? Right. What do you remember? I think there's this division with death where we think that we no longer have a relationship when somebody dies. And that's not accurate in my perspective. Right. I remember being early on in therapy after my dad died, my own therapy. And my therapist very sweetly said, you can talk to your dad. And I was like, no, that's what people do that are insane. And she was like, no, it's not. Just talk to him. And I remember it being such a huge step, because I remember I was praying. I just started talking to him. And I started talking to him at the ocean, because that's really where I felt closest to him and where I really feel my biggest connection to spirit. And it was such a huge thing to give permission to that, because there's so many other things that say, okay, this is the timeline. And then once you're done, that's it. I've always found it amazing that people, when you go to funerals, that people don't do much more than just cry and dab away their tears, and that's not where it ends. Grief really is something that wants to wail. We want to feel it in our whole body. And I think that's something when we allow ourselves to bear witness to children, that they get it. They just do it. And we just have to be able to ask them, hey, is this because you had a fight with someone on the playground? Or is this Is this about, your brother?
Yeah.
And they'll give you words, and, creativity is a huge resource for healing. And kids typically are very creative, and they want to express, and they might not want to express with words, but they want to express to people that are going to just acknowledge, yes,
Yeah. Yeah.
this is hurtful. This hurts. And it doesn't have to stop hurting. There's going to be a time when it doesn't hurt in the same way, but something might come back, and that's okay. It's always okay for your son to miss your son.
Yeah. And I think that as adults, we complicate it, and children really can simplify it.
Mm-hmm.
And they say things like, well, they're with you in your heart. And it's kind of like, how do you even know to say that? But it's also so comforting. And honestly, even when you said, you can talk to them, I don't know why. It was like, I needed to hear that because I forget that sometimes. And I can get wrapped up in the sadness and the heaviness of it. But it's like, I can talk to him, and, when you were talking about the ocean and stuff, I wanted you to share, kind of some of your signs that you've experienced. Cause I know that's a big thing that is somewhat woo woo to some people, you know what I mean? But it's like, I think if we normalize that, it will make people feel like it's okay. And like, sometimes I feel like I'm just desperately looking for something. And like, I'm like, but it's like, even if it's a sign for me and it's not a sign for anybody else, that's okay, So yeah, if you want to talk about some of the signs that you've experienced, because yours are cool.
I want to back up a little and say that my dad and I had we clashed a lot, and it wasn't out of a place of not loving each other. Like, he was a Republican, I was a Democrat. He hated that I went from like, $5 an hour job to $5 an hour job. He really wanted me to have a career and stay in it for 30 years, which I think is hysterical, because I'm basically doing that now, but just not in the way that he would have done it.
Yeah.
And so I told him, after getting my bachelor's degree, that I was in a teacher training to teach yoga. And his initial reaction, and I say this with a lot of love, it hurt at the time, but I love both his reaction and what he did with this. But at the time, he said, I can't believe I spent all that money on your degree, and now you're just going to drop out and be a yoga teacher.
Oh, gosh.
I was like, that's harsh, dude.
Yeah.
And then a year later, I was teaching yoga while I was in graduate school, and he was so proud. Aww. And he never told anybody, but he would come like peeking in my class, and he would try different things. So he very much had a lot of pain in his heart from being raised in a faith that really harmed him. And he really didn't have a lot of emotions to express it. And he didn't have a way to talk about spirituality. And I've always been seeking spirituality. I grew up in a very conventional religion. And then I've always been like interested in all things woo.
Yes, me too.
And I mean, and for a long time, I saw yoga as my spiritual practice. And so he came to, one of the first things he said after his first surgery, first of all, he died in surgery. He said he had died and come back. And so for me, that was a proof that there had to be something out there that was bigger than, because I also had a lot of doubt and skepticism about whether or not there is a God. And I thought he was teasing me at first, because he loved to tease me. He's like, I get why you teach yoga. I'm like, oh, really? I mean, you just had this major traumatic surgery and you just want to jump on this train. What do you head into? He's like, I know that we're all connected as souls. And part of what yoga does is it connects people. And it was sort of like I had a whole new dad for a while. I mean, I had a dad that was disabled, and I had a dad that, we had to kind of quickly catch up to this part of our relationship. But after that, it was like we were in a lot of ways like much more connected than we'd ever been. Like that rebellious, there was still a little bit of that, because it's just frankly really hard for a father to allow, their 20-something daughter to be their caregiver and take care of everything. It's not easy to see them as an adult, which I understand. But before he passed away, he had 6 months on hospice. And I would say everything was tumultuous up until 3 days after he went on hospice. He did not want to go on hospice. He really wanted to find a cure. He wanted to keep trying. He was a fighter, and he didn't want to give up. And unfortunately, a lot of times when people have complicated grief, they see that as giving up. And it's not. I mean, we just don't have the capacity to fight, something as major as brain cancer in the back of our brain. Right. And so we had lots of conversations about God. He actually had the Catholic priest come in multiple times to give him the rites, like multiple times. Like he did it right after his first surgery. Like it was like, hey, Father, how you doing? Like,
Aww.
oh, another rites. Okay. Like it was really important to him that he went to God.
Yeah.
And so he told me, he's like, I know I'm going to go soon. I don't want to go, but I don't want to stay in this body. So I'm going to give you some signs. And I was like, cool, maybe you can make it glitter for me.
Right. Make it very obvious.
Sure. And so a couple months after he passed away, I was in my grief. It was winter time. And I looked down, I was on the top floor of the house where I lived in, and there were multiple ladybugs just walking. And I was like, that's weird. Why would ladybugs just show up? I just didn't understand it. But I have since had ladybugs follow me in the most unusual places. I once had, a new person move in that wasn't a good match for me as a roommate. And I came home one day and she was like, God, do you know there's like 50 ladybugs outside? And I'm like, okay, my dad is trying to give me a message. What's going on? I think he was trying to tell me that this isn't a good roommate for me.
Wow.
And then right after he passed away, I went camping with my boyfriend at the time. And we ended up on the Oregon coast at this beach that was on a reef. And so all the shells that came in were broken. But I just had this very clear awareness that I was going to find 2 intact sand dollars and that was going to be my, something that I could do in some way to honor my dad. And I remember my boyfriend at the time was like, you're not going to find any intact shells here. And I got up at 5 a.m. and it was hard, but I kept looking and I kept praying. And I have 2 beautiful intact sand dollars that I found. And so I actually have a sand dollar on my foot that's in honor of my dad,
Aww.
which is also part of why I feel connected to him at the beach.
Yeah. Now, did you ask, I'm sorry, did you ask for the signs, the 2 sand dollars, or what made you, I'm curious about that.
I don't remember. I just had a feeling that sand dollars were something that were going to connect us.
Wow.
We've only been to the beach twice in our life together, but we went to Ocean Shores, Washington, which I live in Washington State. And I remember playing on the beach and just finding sand dollars and thinking sand dollars were really cool.
Yeah.
And I don't know why it was sand dollars. There was never anything where he didn't love sand dollars. He didn't love ladybugs. He loved golf.
Yeah. I sometimes think that, we need that. I don't know. Like, it's like, there's this weird, needing permission to ask for things why, can we just say, I want a sign and then maybe you'll get a sign, you know what I mean? I don't know. It's really amazing to me because Sweet Child of Mine is a song that's a very big sign for us. My husband used to sing it to Jackson at bedtime. Aww. And we, at his funeral, we did a slideshow to Sweet Child of Mine, and it comes on so much. And I'm like, okay, this is a 34-year-old song. Yes, I know it's a popular song, but it's just the times that it happens, it's just okay, Jackson, hello, I see you, you know what I mean? And so it's just so, I really like signs. I know that when we were talking, one of the things you talked about was how impactful losing your dad was when you were young and how it made you not as carefree. And I would like you to talk a little bit about that.
It's so interesting you say that because I think people saw me as a yoga teacher when I was in graduate school and saw that, I traveled a lot as I didn't have a lot of money, but I was fine with picking up and moving. I bragged about having in my early 20s, being able to fit everything I owned in a car.
That's awesome.
And that was definitely before my dad got sick. It was just very noticeable that I was the only 25-year-old that was taking care of my dad. And I think it made me grow up very quickly because it was just so intense. His illness was very intense. It was very unexpected. I wasn't given a lot of answers. So I had to quickly learn how to navigate insurance, his finances, the healthcare system. the healthcare system when, you're dealing with somebody that, is in and out of nursing homes. There's a ton of politics around that I wasn't aware of at all. I remember getting into a fight with a social worker where she insisted on having my dad be in a nursing home in Seattle. We live 60 miles away from Seattle. And so that just wasn't possible. I remember her just getting so mad at me. She was like, well, we just don't have a lot of placements for men, so you're just going to have to. And I was like, well, then, we'll just wait for something to open.
Yeah.
Which I didn't understand at the time. I don't think they'd let you do that anymore, but it was a big awareness of what ageism was. And I felt like I was getting treated with ageism because I appeared really young, and my dad was getting treated with ageism because he appeared very old. He seemed to age by 20 years from the moment he had a surgery until the end of his life. So I just remembered like seeing people celebrate birthdays or just go out and, do spring break. And I just remember feeling like I am never going to be able to experience these things. And I was also told while my dad was sick, before he went on hospice, that he would be disabled and bedbound for 5 years at least, and that there was nothing that they could do. They were in denial that he actually had brain cancer, which, I'm not a medical doctor, but when you have like a major tumor removed and then it comes back 6 months later, I would say that that's metastasizing. I would say that it's cancer. And that's also something I learned, is that people, even doctors, are very afraid to say death. And so, for me, it felt like the death sort of defined my 20s, when that's not really what normally defines 20s. And so in some ways, I would say I was a little bit behind other people. I wasn't really focused on, I wanted a relationship, but I ended up ending my relationship with my boyfriend 6 months later because I was so, I was so hurt by my dad. And I think that also happens a lot, where people like just can't, if they themselves can't walk with your grief, then, or they let you grieve, they don't know what else to do. And I think, we would have broken up eventually. We were both pretty young in a lot of ways. And probably before that happened, we were kind of on the same trajectory. And he was a very nice man. I just didn't have the capacity. It took me about, I didn't get married until I was in my early 40s. Yeah. And I remembered thinking like, I wonder if some of this has to do with that I'm just so focused on, because it changed my perspective of relationships. It made me think about, I'm doing all this caregiving that normally like a wife would do, or a partner. And I thought to myself, I don't know that I want to do this with anybody again. Yeah. And so when I was dating my now husband, I remember thinking that, is this someone that I would be willing to take care of in this capacity? Yeah. Wow. Which I don't even know. And now that I say that, I'm like, I don't even know that that's required. People get like long-term insurance healthcare plans. I think what's required is that we need to do something about the system, because it's very hard to age in this culture and to be sick in this culture.
Oh, for sure. For sure. Yeah. I can definitely understand the feeling, everything is heavy and harder. And I am not a carefree person. I feel like I'm not fun anymore, and I so badly want to. And so that dichotomy is confusing at times, because I'm like, everything is so serious and hard, and everything is serious in our world, and so it's like, I'm in this process right now of learning how to have joy again and carry my grief, because Ivan has said to me, Mom, you don't smile very much anymore. You don't laugh like you used to. And I can't disagree with what he's saying, but it's like, it's an intentional choice for me to say, I do not want Ivan to look back and all of his memories are just that his mom was sad, and so it's not easy. But I feel like it is possible with a lot of work, and a lot of people, it's too hard. I mean, one of the things our grief therapist says is grief therapy is like touching a hot stove, not everybody wants to do it. And so, it certainly is no judgment if people can never get to that point or don't ever want to get to that point. But it's, for me, I'm trying to make a decision to, have more hope and joy in my life. And, one of the things that I wanted to talk about was the difference between grieving and mourning. That was something that we had kind of had a conversation about. And I think that it's very important to differentiate those two. Mm-hmm. So how would you differentiate grieving and mourning?
I definitely default to the word grief, but I think of grief as just having lost something significant, whether it's death or otherwise. Mourning, I think, comes from the actual act of letting yourself move through the process of grief. So as you were talking about that, I was thinking about a couple of things. One is the Jungian perspective is that we kind of get into either or thinking, like either you're happy or you're sad, either you're grieving your son or you're there to be, with your son. It's like it's like you can do both. And so I love this both and this, like, I can be really sad and also love you and be a mom. Yeah. I think that's really important to hold that. And when we hold that for kids, we tell them, like, you can be sad. You don't have to put on a happy face. You don't have to put on a mask. Right.
Yeah.
And when appropriate, one of the theories I was trained in initially was dialectical behavior therapy. And I at first sort of balked at it, but one of the coping strategies is to act with opposite emotion. And so sometimes we do get too much into our feelings. It's like, we get into that mode where it's like, we just can't stop thinking about the person, or we can't stop crying, or we can't. And, at times, not always, like, and I always trust the wisdom of the person that is mourning, is we need a little break, or we need a reprieve. And so sometimes acting with the opposite emotion is really, really essential. I'm really sad about losing my dad, and I'm going to go enjoy a cup of coffee and a walk with my friend.
Yeah.
I can do both. And I also think it's important to give ourselves permission to do that and know that, my belief system is that my dad wants me to live my life. He wants me to be happy. He's not, I don't think dead people are looking over us going, did you think about me today? Because if you didn't,
how dare you? Right.
Yeah. I like metaphors or visuals. And so the visual I think about, especially with mourning, is that if we don't actually do the wailing or the mourning or the ritual or whatever it is that because everybody's grief is different, whether it's complex or not, we just need something to do to move through the loss. So I think about it like if you were to, clean your whole house, but you were to like sweep everything under the carpet, like over time, like there's going to be like this little, little thing that like builds up. And then when people ask, like, we just don't talk about that. Right. That is a lot like what it's like it's sort of like grief freezes us in time until we're ready to move through it. And so if you have the capacity, and I don't think everybody does have the capacity to immediately go, I was lucky enough to have a lot of skills and a lot of support around me when my dad got sick. Yeah. I definitely didn't feel like I knew what I was doing. I didn't feel like I knew what I was doing for a long time. Right. But I had a colleague of mine say, when I had told her initially, because we came back from school and everybody was like, what was your summer vacation like? And I was like, my dad died. And I remember this woman said to me, I lost my dad 25 years ago and I still miss him. And that just hit me. It's like, it gave me permission that, first of all, I can miss him for the rest of my life. There's no rule that I have to, I still have a dad. I don't actively celebrate Father's Day because for me, that's a sad day. Right. But I do try to find spaces to honor myself, and in honoring him, what I'm really doing is honoring myself. Yes. And so the mourning is not letting everything get swept under the rug. It's because people will come to therapy, 20 years after losing somebody, and they're completely surprised that in talking about their loved one, that they're suddenly in tears, or it feels like it was just yesterday that they missed them. I think grief is designed that way. Yeah. It's designed for us to, we want to remember, but we also don't want to spend the rest of our lives in agony about it either.
I had seen a quote that's also, I'm a big quote person. And the quote was, the pain will be there until it loosens. And it was like, you know, just kind of knowing that it's something that you have to go through, but you can go through it. And yes, it's going to come up in other ways, in different ways. But I've kind of personally, just being honest, I've tried to avoid it in the past. And I found that it doesn't really work. And so I'm not the kind of person who kind of likes to keep doing the same thing over and over again. And I'm not saying I don't ever do that, because I definitely do that. But I try not to, you know, so I'm learning how to kind of let myself feel it. And it's kind of helping me not to live in agony and stay in agony, like you said, you know, because it's like nobody in their right mind would want to live in this kind of pain. Like it's not fun. It's not fun at all. And so, I mean, we could probably go on and on and on and keep talking. I can tell that. But I just want to wrap it up and see if there was any kind of last thing you wanted to share, or just anything you want to impart.
Actually, I just want to end on just sharing this with you, what you just named. I think avoidance, you know, the typical acronym we think about with grief is denial, anger, bargaining, depression, acceptance. And I think that denial is one where a lot of people stay for a long time. And there's nothing wrong with that, you know, until we have other spaces where we really are allowing people to, you know, be open about, you know, how complicated these feelings are. I think that is a survival strategy. And that's what we sometimes have to do, is just survive. And so I would never, ever say to somebody, you know, you're avoiding, you need to stop that right now. You know, you need to have something else to support you before you can stop avoiding.
Yeah, that's so true. Yeah, I mean, this conversation has been so wonderful in that there have been so many things you've said that, like, sometimes we just don't realize that we need to be told it's okay. We need to be given permission. And I always feel like, you know, I don't have all the answers, but I feel like having these hard conversations helps to shine a light on something that sometimes people don't know how to talk about. They don't know where to talk about it. And so, you know, if we said one thing today that helped somebody, which I know we did, then we're making a difference, you know? And so I am just very grateful. I'm so happy that this was no accident, that we were put into each other's lives. And so I just want to say thank you so very much for this wonderful conversation. And I can't wait to share it. So thank you so much.